Assalamu alaikum and good day everybody. Today inshallah we'll speak about the introduction of the veterinary anatomy. So veterinary anatomy means the study, the structure and organ and tissue of the domesticated animals including equine and ovine and bovine and also avian anatomy. So the division of the anatomy, we have gross anatomy, means have to study the structure by naked eye. Also, the histology means to study the anatomy under microscope, and then you have a morbid anatomy to study the disease structure of the organism. And then we have applied anatomy using landmark to detect certain, structure and, for clinical problems. Also, we have the embryology, means study the fertilized egg until birth, and then teratology means study the abnormal development of the organism. So domesticated animals including bovine, ovine, porcine or swine, and they have feline. And then you have the caprine, equine, canine, and avian species. And each one, as you can see, have male and female. So the method of study of anatomy, we have systemic anatomy and we have topographic original anatomy. Systemic anatomy means to study the systems, including osteology, mean the skeleton, arthology, the joint, and myology is the muscles, and geology, the blood supply, and also, neurology, nervous system, and physiology mean the sense organ and integument. Also, we have splanchnology, which including the nervous system, and urinary system, genital system, and the respiratory system. The second method of study anatomy is the topographic or regional anatomy, means we have described certain area including like limbs or hidden neck, and pelvic cavity. So we have descriptive terms of very important to know the structure and description of the anatomy. So you can see we have dorsal, mean towards the dorsum, and we have the ventral, they have medial, and they have lateral. So you can see we have different terms, right? Like axial, abaxial, cranium, mean the skull, and then you have the external and the internal. So you can see now when you read it, you understand that we have the different terms. Also, you can see now below the corpus joint, we have two different terms. Cranial will be like a dorsal, and caudal will be the palmar. In the hind limb, below the tarsal joint, we have dorsal instead of the cranium, and we have plantar instead of the caudal. And don't forget, in case of the head, we're using rostral, right, not cranial, because this is like the nose. For example, you can see the nose is rostral to the ear, or rostral to the cheek. So if you look at this diagram, you will see dorsal here, mean above the in the back of the animal. We have ventral towards the belly, they have cranial towards the head, caudal towards the tail, and you have dorsal and ventral. And also you have caudal, but if you came for the face here and the nose, you can see rostral instead of saying cranial. Again, above the elbow, above the corpus joint, we have cranial and caudal, and below the corpus we have dorsal and palmar. In the hind limb, above the tarsus or tarsal joint, we have cranial and caudal, but below the tarsal we have dorsal and plantar. What about the planes of the body? Plane means you can take 2 points and you have to connect the 2 points together. So we have, you can see now in the diagram, you can see here we have the dorsal, we have the sagittal plane or mesogeital plane. You can see now we have the median or mesogeital plane, mean if you divide the body into 2 equal halves, and any line parallel to the median plane would be sagittal plane. Transverse plane if you want to divide the structure into cranial and caudal segment, and frontal plane if you want to divide the structure into dorsal and ventral option or portions. A skeleton, we have the skeleton. Now we have 2 types of skeleton, exoskeleton and endoskeleton. And the skeleton is important because it make the frame structure support the the body, and also protect certain organs like soft organs in the body. So an important of the skeleton to support vital organs, to give rigidity of the body, and also for muscle attachment, and also for minerals and phosphorus. And we have exoskeleton and endoskeleton. Exoskeleton, we have three parts of the endoskeleton. We have axial skeleton, which includes skull, vertebral column, ribs, and sternum. And we have appendicular skeleton, including forelimb and hind limb. And then we have a splanchnic, skeleton, which means certain bones present in soft organ, such as os penis in the penis of the canine, os cordis in the heart of the bovine, and os rostral in the pig nose, and os diaphragma or os phrenic in the diaphragm of camel, and os opticus in the birds. Appendicular skeleton including overall a certain bones. So you can see we have scapula, humerus, ulna, and the radius, and then you have carpal bone, and then you have after the carpal bone we have metacarpal, and then you have the digit, which including first phalanx, second phalanx, and the coffin joint. And in hind limb we have certain bones which will be discussed later on in detail. We have the pelvic bone here, then you have the femur, and then you have the patella, and then we have tibia and the fibula, and then tarsal bone, and then metatarsal bones, and then we have the digit, including first phalanx, second phalanx, and the coffin joint, third phalanx. And don't forget also both of them, fore and hind, they have sesamoid bones. Let us speak about the types of bones. So bones, according to structure, we have compact bone and we have spongy bone. According to the shape and the function, we have long bone. Once the bone has proximal extremity and distal extremity and a shaft, and this shaft including bone marrow, right, such as femur, humerus, radius, this will be including as typical long bone. Atypical long bone, we have elongated bone and we have reduced bone. Elongated bone such as the ribs, which has no medullary cavity and also have only proximal extremity, but they don't have this extremity, such as ribs, is important for muscular attachment and also for to support the thorax. We have the second one, reduced or aborted bone, which is the no or low bone marrow and only have proximal extremity, such as ulna, fibula, and splint bone, which is like second and fourth metacarpal bone, or second and fourth metatarsal bones, and this bone is important for muscular attachment. Short bone, we consider as carpal bone here is the cubic form and is important, for facilitate joint movement and also diffuse concussion as important, such as carpal bones in the forelimb and tarsal bones in the in the hook or tarsal joint. Flat bone, you can see is bones of the skull and also scapula, considered as a flat bone, and is protected the organs and also for muscular attachment, such as skull bones and scapula and also sternum. Sesamoid bone present in certain joint. We have, for example, we have three sesamoid bone. We have the two proximal and the distal one, which is known as the navicular bone in the fore and the hind limb. This one is important for for decreased friction and also change the direction of the organ. Also, we have irregular bone, which is example of that is the vertebrae of the vertebral column, as a very important because for muscular attachment and also to support the spinal cord. Also, we have pneumatic bone present in the skull, such as maxillary bone and also frontal bone, and also the bones of the birds, and this is why it's important to fly, because the pneumatic bone. Right. Let us now speak about the descriptive terms of the bones. So the bone is not smooth. The bones have bone structure like could be projections or depressions. We classify the projection and depression into two categories: either projection for articulation or just projection, and this was called articular, or would be only for muscular attachment and not for for articulation, and it's called non-articular. So we have pony projection, we have articular projection, and we have non-articular projection. For depression, we have articular depression and non-articular depression. So let us speak about the pony projection first, and the first one subtype is articular projection, such as the head of the humerus and the femur is important, as articular projection to, for the humerus to articulate with the glenoid cavity of the scapula and the forming shoulder joint. Also, in the hind limb, we will have the head of the femur is important to articulate with the acetabulum to form the hip joint in the hind limb. Condyle also important. Condyle here of the humerus, we have medial condyle and lateral condyle to make the elbow joint with the radius and ulna. So condyle is articular projection. Trochlea of the femur is important. Everybody knows the patella. So this is to articulate with the patella to make femoropatellar joint. So trochlea also is articular projection. Then we have the facet, especially we have costal facets in the thoracic vertebra to articulate with the for example, head of the ribs to form the socket of the rib. So facet in the vertebrae also is for articular projection to make the socket of the rib. The second type of the projection is non-articular projection. For example, the process, like in spinous process of the vertebrae here is not for articulation, is only for muscular attachment. And also you have like a crest, and you have trochanter, like a trochanter of the femur, also for muscular attachment, and also tuberculum, and the spine of the scapula here for muscular attachment, and then ridge, neck of the scapula or neck of the of the humerus, also and line and the epicondyle of the femur. All this example of non-articular projection. Second one is the pony depressions. As we mentioned, we have the first one, articular depressions and non-articular depression. Example for articular depression is the glenoid cavity of the scapula to form a shoulder joint with the head of the humerus. Then we have cotyloid cavity, which is present in the and the hip acetabulum of the hip joint. And then we have like a notch example, the similar notch to make the elbow joint. Non-articular depression, including like fossa, for example, supraspinous fossa in the scapula is non-articular depression. Fovea in the head of the femur also is important for ligament attachment, not for articulation. And also we have foramen, like a vertebral foramen, also is only for a spinal cord, not for a joint. Then we have like canals, for example, the vertebral canal, and then you have like sulcus of the humerus, for example, here, right, for muscular attachment. And then we have like a fissure. All this is considered as non-articular depression. Thank you so much for this video, and if you are interested to continue for making more video for the anatomy, please let me know in the comment. Thank you so much, and have a successful academic year. Thank you so much.